I'm live. Oh, geez, look at my hair. It's crazy. Hello,
Crazy.
YouTube. Hello,
Hello, YouTube.
YouTube. Hello, TikTok. It is Tune In Tuesdays. I think I was gone last week. I look kind of tan. I am running a half marathon in was that last, did I just come back? I've been running a half, no, that was the week before. I worked all weekend. See, I lost track of my days because I gave an online course to doctors all over, but mostly Romania. So they wanted us to start at 6 a.m. And so 6 a.m. start, that doesn't mean get up at 6 a.m. And so coming back onto Eastern time from the West Coast, not West Coast, but Mountain time, it was rough for me. I mean, the first day I did not feel good for, I don't know, I felt sick for the first few hours. And interesting, I forgot to change my patch. So for those of you that are taking an estrogen patch, I change my patch every 5 days instead of twice a week, just because I'm in between doses. So I should have put a patch on that morning. And wow, was I surprised at, like, I don't know, it was brain fog or what it was, but I was not doing very well. The next day I did a little bit better. But anyway, I'm here Tuesdays. What have we learned today? I recorded a video for a brand today about probiotics, how much it affects gut health, but I'm happy to entertain any of your questions. And as you guys know, I am a doctor, not your doctor, so I can't really give you any medical advice, but I am happy to point you in the right directions. I'm on here to try to advocate for you guys to get the help that you need and also educate. So let's see. Whenever you guys are ready, you can start in on YouTube. Also, if you guys want, God, my hair is like, I don't know what's going on with it today, guys. But you can list any questions that you have about hormones, longevity, biohacking, prevention, women's health, and I will do my best to answer your questions and at least point you to a source that can help you if I can. What am I working on this week? Going down to Nashville this weekend for a business conference. More working on like brand management and trying to figure out where to go from here, what to do. As I mentioned, I taught the course this weekend. So it was pharmacists and prescribers, some naturopathic doctors. It was all about a basic course about bioidentical hormones, about what to prescribe, how to test. Next weekend, another kind of business thing, but also working on some things behind the scenes. We do, for you guys that are not subscribing on our YouTube channel, make sure you do. Tara Scott MD. Please subscribe to our newsletter. We have a free newsletter that comes out every Tuesday. And also we have some new free downloads. One is about natural therapies for mood health, mental health, and one is about testing. So Generation, thank you for the first question. Woo woo, you win the prize. We actually have a new free download about testing if I don't answer all the questions, but your question is, what's the actual name of what blood panel for testing estrogen? So it's not a panel. I think you're talking about the actual, what the hormone is called. It depends on if it's LabCorp or Quest. We just do ultra-sensitive estradiol. So it's not usually labeled as LCMS-MS. You might see estrone labeled as LCMS-MS or progesterone LCMS. So it's just estradiol ultrasensitive. And I'm fairly certain that LabCorp calls it the same thing. If you're going to a local lab like a hospital lab, they may not call it, but just make sure you're not getting total estrogens ordered. We want estradiol or estrone, not total estrogens, because those are very difficult to discern. And a lot of people make estrone after menopause, and what we're really looking for is estradiol. Another interesting fact is that I've seen several people with early menopause, premature menopause. So the definition of that is less than 45, and it's called primary ovarian insufficiency, or POI, if it's less than 40. And I just think it seems like we're seeing more and more women younger that are having menopause or problems with their hormones. And so for those patients, it could be genetic. It could be a genetic mutation called Fragile X. It's a pre-mutation, actually. So I had a patient that came to me out of state for that. It could be yeast overgrowth. It could be mold. It could be heavy metals, or it could just be accelerated ovarian aging, which is somewhat genetic also. What's the best supplement to help take for endometriosis? Great question, Mish. I would say the couple that I would say is N-acetylcysteine, 500 twice a day, or resveratrol. Both have data. I think the study on resveratrol though was IV, so there may be more data on the N-acetylcysteine, 500 twice a day. Do we have a YouTube? I'm so bloated on 100 milligrams of progesterone. I hate it. Also taking 0.5. I think I'm going off of hormones because of it. Wondering if you might do better with a different form of progesterone, maybe a slow release. I don't know how long you've been on that, but a lot of times it's a transient side effect. Like what that means is it's just as your body's adjusting to it. So 0.05 estrogen isn't a low starting dose. I'm not sure if you started on that. That could be the issue, is that you have more estrogen than progesterone. High estrogen can also cause bloating. When we have people on 0.05, not that it actually is an exact science, but generally by then they're on the 200 milligrams of progesterone. So who knows? I'm not sure if your bloating is because of your estrogen dose or your progesterone. Okay, great questions though.
6 years.
Oh, 6 years. That's odd. Okay. Show enough. Good to see you here. Estradiol versus Elestrin, which is better for postmenopausal in gel form? Okay, great question. Thank you for asking. Elestrin, I don't even know if it's still available, show enough, but I will tell you that I think that has a very long half-life, like 48 hours. People tend to accumulate. If you're giving yourself something daily that lasts 2 days, you're going to be overdosed soon. So if I had to choose which gel for you, Divi gel just went generic. It's estradiol gel. There is also an estrogel. That's an 18-hour half-life, but I like the Divi gel single serve, little sachets they're called, little packets, foil packets of estrogen, and there's 0.025, 0.05, 0.75, 1 milligram, and 1.25. So a lot of doses. So that would be my vote. Irrelevant to the topics you mentioned, 4-year-old with gluten intolerant, any naturopath docs you recommend? Naturopathic doctors. Okay, let's see. Peds, Elisa Song. I don't think she's a naturopathic doctor. She's an MD in our functional world. She's written a lot of great books about peds, but definitely Zuli, taking your kids off glutens. All three of my kids are gluten intolerant. One of them is still in denial. 2 of them don't eat it. I think we got another YouTube question. Okay. If you feel better and can lose weight on your period and not so much the rest of the month, does that mean you're estrogen dominant? Great thought, Purposeful Life. That is true. That could be the consequence, that once that estrogen drops on your period, you feel better. So I would think that probably too much estrogen. What would you suggest taking if you're estrogen dominant, Jim? So sometimes DIM helps. It really depends. Sometimes it doesn't add anything to people. So calcium D-glucarate is something you could add, magnesium, and B vitamins. What's the first supplement I said to take for endometriosis? N-acetylcysteine and resveratrol. Samantha, I'm 43. I feel like a shell of myself. Where do I start? Oh, please don't take the birth control pill. Find someone who can check your hormones, because at 43, you absolutely are not too young. I started at 38, and the first thing I needed was micronized progesterone. I didn't need estrogen at that part. My adrenals were terrible. My cortisol was terrible. If you can see a functional medicine doctor that specializes in hormones, that might be a good place. Samantha, a lot of the testing that we do is blood testing for people like you. Melissa, I had a prophylactic full hysterectomy and mastectomy postmenopausal. Take the estrogen 0 patch. Well, Melissa, I hope you're recovering well, and I hope you're doing well. Sabrina, how do you feel about Climera Pro patch? Well, I'll tell you, I like that it's estradiol, that is bioidentical. I like that it's a transdermal patch for estrogen. But that, Sabrina, is not a bioidentical progesterone. It's a progestin, which progestins have an increased risk of breast cancer and blood clots, although it's transdermal, I'm just not a fan of synthetic progestins. I think they do a great job to prevent pregnancy, but not to replace hormones. It's like if you had a diabetic patient who had a really low blood sugar and you kept trying to give them Splenda. Splenda doesn't do the same thing in the body as glucose. Glucose is going to bring your blood sugar up so you don't pass out, but Splenda's not. Not sure if that helps you. Do you believe progesterone cream can help endometriosis? Some. Mish, good question. It's really variable. I have some patients that progesterone helps, but what endometriosis is sometimes a progesterone resistance. And so aromatase might help better blocking that aromatase. So it's not certainly going to hurt. John, Matt, what did you do residency in? I did a residency in OB-GYN, and that was 1992 to 1997. So yeah. Can an IUD help with perimenopause symptoms? Vet girl. So an IUD is a synthetic progestin. It will help with your bleeding pattern. If you have painful periods, it will help with that. It will not help with your night sweats. It will not help with your weight gain. In fact, a lot of people do gain weight with the IUD. I did. Hi, not too shabby. Good to see you. With an IUD, it's not going to help your moods at all. As a matter of fact, it's the opposite. It's certainly not going to help your breast tenderness, because there's actually a couple studies that show the opposite, that it causes dense breast. Angie Brown, I just started Divi Gel and Prometrium, switched from the Combi patch. Love this new Combi. Well, I am a fan of Prometrium, which is micronized progesterone, bioidentical, and I am a fan of Divi Gel. Not too shabby. Love what you're doing. Keep it up, girl. Love watching your videos. Mary Daniels, glad to see you here. So is perimenopause worse than menopause since hormones are still chaotic? I think so, yes. I think people feel so much better when they're done. That's my opinion. Sabrina, can't tolerate pure progesterone, terrible cramping. What can I do? You could do vaginal progesterone. It really just depends. It's I haven't really met many women that can't tolerate progesterone after we deal with the dosage. There's a few, but mostly it's an initial thing. They're on the wrong dose or on the wrong combination. But most of my patients, once I get their estrogen to the right level, then they can. So I don't, it's hard for me to say, Sabrina, really what's going on with you. Liberican, I like your name, Liberican. I call myself an Indo-Rican because I'm half Puerto Rican. So I love that name. I'm tired of the long bleeds and clots. Yes. Okay. That's estrogen dominance. There's also a medication trial that is not hormonal, called tranexamic acid, that you can take just during your period to decrease the flow and the clots. What is the best dosage of estrogen patch for someone that had a hysterectomy at 60, no ovaries? Gosh, there is no best dosage for everyone. Everybody's completely different. We always just start with the lowest dose patch, 0.025, and go up 0.0375, 0.05, 0.06, 0.075, 0.1. So there's such a huge variability. So I'm not able to answer that question. Is trazodone good for perimenopause insomnia? Well, it doesn't treat the cause. It treats the symptom. So if the reason you're not sleeping is because of your cortisol or because of your progesterone, it's only going to treat the symptom. However, it's not supposed to be addicting, so it could be an option. Not what I would choose, but it could be an option for you. Doc says it's normal for perimenopause. Can I buy OTC progesterone cream? You could try that. Ask them for tranexamic acid. It's also called Lysteta. And you're allowed to get a second opinion, Liberican. You can go to someone who's experienced in checking hormones. Brandy Plemons, I'm wondering if your hormone migraines are the day before your period starts or after a mid-cycle. So the recommendations may be a little bit different, but my basic recommendations for migraines are 100 milligrams of B1, 100 milligrams of CoQ10, magnesium, fish oil, and why am I thinking of? I'm forgetting another one. CoQ10, B1, magnesium, vitamin D also. Another question?
Valencia, start with her.
How do I build my estradiol up from 75 between 100 and 125? I've been on for about 6 weeks, compounded one click. Well, part of the issue is if you're taking topical progesterone, you're not going to see the blood levels go out. So it's going to be hard to see those levels go up on a topical estradiol. The next
10.
question was, I had a hysterectomy at 43, kept my ovaries good. I've been feeling all over the place. My OB gave me the estradiol patch. See, that's the problem, is you're all over the place. You're 43. You likely need progesterone. But your OB won't give that to you because they think you don't need it if you don't have a uterus. But the hormone that you're deficient in is likely not estrogen. You probably would benefit from getting your levels checked to see what's going on.
Jennifer.
Do you recommend sequential or continuous hormone therapy? In someone perimenopause, we usually cycle it. So sequential. Doctor says my hormones are all normal, but I'm having perimenopausal symptoms. I'm wondering, Lizzie Gutierrez, did they know what time of the cycle to check you? Did they check you on day 3? That's not the right time to check you in perimenopause. Did they check you on day 21? Do they know what part of the cycle you were? Oh, sorry, that wasn't Lizzie. That was Vet Girl. That's usually what I find.
Purpose-filled life there.
What do you suggest if you're exercising, eating healthy, counting macros, 41, and getting sleep and doing intermittent fasting? What would you suggest for help for weight loss? Again, I mean, we do a complete evaluation of your thyroid and your hormones, and a lot of times all of that hard work doesn't help unless your hormones are balanced. So if you are having excessive estrogen, like exercise isn't going to help. Okay, now to your question, Lizzie. What are your views on miscarriage due to chromosomal abnormalities? Well, it's said that most of the miscarriages are thought to be due to that, especially as you get older. Some of them are thought to be due to low progesterone. Sabrina asked about duvet. So duvet, I'm blanking on it is a synthetic hormone and a bioidentical. And I really cannot remember. It's a SERM, a selective estrogen receptor modulant, maybe progesterone, maybe that's it. It's oral also, so I'm not a fan. Katya, is it normal to be bleeding on depot after getting 2 shots? Well, most people on depot don't have any bleeding at all. So it's not necessarily abnormal to be bleeding. There is really no norm, but it is usually suppressive of your period. So it could be an issue, but it could be fine.
The second one down here for Tan, who had the...
My blood work shows I'm in menopause. So blood work cannot diagnose menopause. Only 12 months without a period would be with your menopause. If you don't have a uterus and you have an IUD or you have had an endometrial ablation and you don't know about your periods, then you have to have 2 separate blood draws 4 months apart with an FSH above 40. I hate taking progesterone because it makes me feel like a zombie the next morning. Yeah, so that could be because you're on the immediate release form, and that can happen. So most of my patients do better with the slow release form. Some of my patients do better with the troche or an under the tongue form, and they take that in the morning. It's not as sedating. What should you take if your progesterone, what day should you take progesterone if your period fluctuates? Most of my patients, Chrissy, started on day 15, unless you're trying to get pregnant, then 2 days after ovulation. So, and they take it through that time period until the next period starts, whether it's say 23, 28, 35. Keep taking it. That girl, what can I do? I'm 39, almost 40. I had a tubal ligation at 34. What can you do about your hormones? I would highly suggest seeing somebody who has training in hormones. And now with social media, you can vet these people. Go to someone who's going to check your labs and know when to check them. Some of the directory at the number 4M, a4m.org, it says up in the corner, it'll say provider directory, and you can put in there someone who specializes in hormones, and you can put in your zip code and find someone who is near you. Nancy Johnson, 89, 62, just put on Avexipil, testosterone and estrogen. Avexipil. I'm not sure what Avexipil is. Testosterone, estrogen, also on progesterone. Well, Nancy, not really knowing your history and your levels, I can't really comment, but I like that you're including all the 3 hormones, that it's not just estrogen, and it's estrogen and there's progesterone. So I'm glad. That girl, see, you got your labs done on day 3. Girl, progesterone's never going to be abnormal on day 3. You have to check it after ovulation. It's always low. Okay, Mary, on 200 of progesterone, I've had 3 hours of sleep a night the last week on my period. What can help? Well, it's hard to say if you have a hard time falling asleep or staying asleep. Some people have luck with all these sleep gummies that have melatonin, also lemon balm and L-theanine. Another thing called Source Naturals that is theanine serene has been really helpful for sleep. When you're on your period, usually we have you stop the progesterone. Isabella Stanley, would hormonal problems show up in my blood work? What should I be looking for? Again, it's really hard for me to impart 20 years of knowledge into a quick question. So I know what to look for because of my experience, but it's not something that I can really say. So it depends on your history, your age, your clinical scenario, when the blood is drawn, what phase of the cycle the blood is drawn, and all of the balance. So that's how we interpret the blood testing. It's really actually not just a really easy thing to say, if it's here, that means this. That's probably why a lot of people don't do the testing because it's so nuanced. But Isabella, I will tell you that I did just formulate a testing guide that's free. It's a free download. So check out the link in my link tree here or go to my Instagram, Hormone Guru MD. Make sure you give us follow there, and also check out the free download about testing. And maybe that can answer some more of your questions. Is it normal to be bloated after stopping continuous progesterone? Well, bloating can be caused by too much cortisol, too much estrogen, not enough androgens like testosterone, DHEA, or gut microbiome issues. And I've actually had a couple people with bloating that had blood sugar instability. So really hard to see what your cause is, but that could be it. I love OB-GYN, but I want a life also like endocrinology. Oh, okay. So you're talking about, yes. Okay, so here's my advice. So I just was running with a girl that I've been mentoring since, I don't know, kindergarten today. She's super interested in what I do. She wants to do OB-GYN residency, then probably a reproductive endocrine specialty. So that is 7 years after medical school. So that's a lot. So it depends. You can do OB-GYN and then you can do a reproductive gynecology fellowship. Like I said, it's 7 years. You could do a family practice residency with an OB concentration. That's 4 years. And then do your integrative medicine training and do things that way. Sabrina asked if I offer telehealth. So I have to follow the laws of the states that I'm licensing in. Currently, I do have a Florida license, but I am letting that is going to expire, and I'm not accepting any more Florida patients, so I'm not able to. But we do have a Forum Health Tampa. So I work for an organization called Forum Health. If you're interested in becoming a patient, there are 40 sites that I don't work at, but other practitioners work at. So there might be some options. Isabella Stanley, what are your thoughts on the progesterone cream? So the progesterone cream over the counter can be helpful, but it's not regulated. So I don't really know the ins and outs of the brand. Do they do third-party testing? Do they validate their dose? I don't know. So if I'm going to use progesterone cream, most of the time I'm prescribing it to a compounding pharmacy. So, okay. So, Vet Girl, I think I answered the question about telehealth. Our patients have to be seen in Ohio first, face to face, and then we can do telehealth. But I am working on something through my practice, through our company, Forum Health, that maybe we can start reaching more people. So it's still in the very early stages. User 3925. Oh, thank you for coming on. I have been in the sun. I've kind of taken a little bit of a break from social media. I've been super busy this spring teaching a lot of courses. And also, honestly, it's a lot of time. And I'm really busy in my office seeing patients. And I've been really busy on the weekends teaching other doctors. So it's hard to find additional time to do the social media. But thank you for saying that. Mary, does the patch absorb best in thicker areas of the body or slimmer? Great question. Most of my patients put it in their lower abdomen. Some of them put them on the back of their arm or anywhere on their thorax, which is basically like rib cage and abdomen. How long after breastfeeding does it take to see your hormones leveling up? As I am 41. Great question from YouTube. It depends on how long you're nursing. If you're nursing 6 times a day, quantity, you are likely not ovulating, so hormones are still going to be suppressed. If you're having regular periods again, we can definitely check things.
Jennifer asked.
If your first month on HRT, you start estrogen patch before the progesterone, if you are sequencing it and start that on day 14. So usually if you don't have periods, we have you start them together. But if you're sequencing it, we have you just take them and then stop them both on your period. BC Fighting Mama Henson, does sugar feed cancer or does it affect hormones? I believe there's a lot of data that insulin is not good for cancer and neither is sugar. And so cancer cells, part of what cancer is it takes the nutrients from your healthy cells. So normally when patients have advanced cancer, it's not so much that the cancer is actually causing a problem, unless it's in a vital place like your liver, your brain. It's not usually in your heart or your lungs can't breathe. But what it does is it takes all the nutrients and energy from your cells. So patients basically get malnutrition, and that's usually what causes their death. So it's not, so yes, absolutely. Sugar is very important and not good for cancer. You're right. Isabella, I go to my primary regularly. She says it's fine, but I have a lot of symptoms. Well, I can tell you, Isabella, that I'm a traditionally trained OB-GYN and we got zero training on hormones. So I'm guessing that your primary care doctor got even less training on hormones. If I'm an OB-GYN, who you would think would be dealing with hormones, and we got none. Summertime love, I feel good on estrogen, testosterone, cycling, progesterone, but weight and bloat are terrible. Summertime love, a lot of the time, if you hormones are like Goldilocks, too much can make you gain weight and too little can make you gain weight. Okay, hard hands, are there networks to find docs in my area? Yes, I said the letter A, the number 4M, a4m.org has a provider directory. You can also find some on the menopause.org. Those are going to be traditional doctors who are not going to be afraid to prescribe you hormones, but they're probably not going to check your hormones.
Nikki, bottom.
I'm new here. What is good for hot flashes? Okay, as far as a supplement, there's some supplements that have rhubarb in them that are supposed to be really good for hot flashes. Saffron has been good. Evening primrose oil. Again, it depends what the hot flashes are from, but great question. Mind Master, good answer about telehealth. We do the same. Yeah, we have to see, and that's Ohio's law. We have to see them first face to face, and then we can do for 1 year telemedicine. I did have a license in Florida that I could do telemedicine without physically seeing them, and also Montana, but I have not renewed those. Mary, you've been on HRT for a year, doing good up until some stressors. Is this normal on HRT or should increase? It really depends on the patient. Some people get the dose right the first time and they don't need to titrate, and some need to. User 5470925. I have PCOS. My testosterone is so high. I have all the symptoms, but what do I have with high cholesterol? Get a hold of the insulin, okay? Once you treat the insulin, the cholesterol will come down. Low glycemic, low carb, higher protein, modified paleo, get exercising, do intermittent fasting. Those are all things that can help. Inositol, 1 gram twice a day is a good thing for your PCOS. Calibug, if you think that I'm skipping your question, it has been filtered out. I am not skipping any questions. There must be something about the way you worded it that TikTok threw it out. So try redoing your question with another word and maybe I'll be able to see it. Miss Parker, for real, dealing with heart palpitations after eating and panic attack. Okay, so those are probably from shifts in either cortisol or estrogen. And so one of the things that can help that is pharmagaba or L-theanine. Those are two pretty safe supplements. Again, not knowing your medical history, I can't really give you medical advice, but those are things that have worked for my patients. Samsara, I just started testosterone injections, estrogen and progesterone 3 months ago, premenopausal. Okay, well, I hope you get some relief from that. What number should I be looking for testosterone levels for a woman? Well, see, that's there is no gold standard, but I will tell you that there are some providers that think it should be 3 times the normal range. So I don't usually use those ranges. So that's a good question for your provider. Could you repeat the name of the provider directory? It's the letter A, the number 4, the letter M, A4M.com. Or no, it might be .org. JC, menopause a year and a half, started HRT 1 year ago and just had a period this week. You know what? It seems like I'm seeing that a lot. You do have to get it checked out. But yes, I have had people who are have some postmenopausal bleeding, and so it could be nothing, but you should call your gynecologist. Sabrina, I know that's one of the reasons I'm on here. That's why I know there's a lot of people who are suffering. So if there's some way I can help, I try to. Katie Danielson, help, no interest with spicy time with my significant other. Katie, do you think that you're having a lot of stress? Because what I'm finding is stress is the sex killer, right? And so oxytocin or cortisol suppresses oxytocin. So some of my patients have done well with oxytocin. So we prescribe that for them. But it could be any of your hormones. It could be testosterone, it could be DHA, it could be estrogen. Kelly Bug, night sweats after hysterectomy, cannot do HRT. What might help? I have not really met that many people that can't do HRT, so I don't know if you've been told that and that's actually true or not. That might be what somebody thinks, but that might not be accurate because even in the menopause position statement in 2022, it doesn't say breast cancer patients should never take hormones. It actually says if other things fail, they can consider hormones. So I don't know what reason you have, Kelly Bug, for not taking it, but you could try the rhubarb supplement or evening primrose oil, or you could try the new prescription Vioza, which is prescription for hot flushes. Beatrice Garcia, inflammation is bad, taking progesterone on patch and estradiol. Do you know where you are having inflammation? Good anti-inflammatory is turmeric, but looking for the sources. Is it your gut? Is it your cortisol? Katie, you're stressed daily. You work as an RN. Try doing some breath work. Try a meditation app, Headspace. At one time with your NPI number, and if you were a healthcare provider, it was free. So even just 10 minutes twice a day could be helpful for you. I strongly encourage you to do that. But you also could have a hormone issue. So for those of you that are on, as I mentioned, we have a free newsletter every Tuesday. So head on over to the link in my bio to subscribe to that. And if you haven't subscribed to our YouTube channel, make sure you subscribe there. Would love it if you would follow me here and on Instagram. Hormone Guru MD. I'm actually not sure because I know they still were saying TikTok might go away again. So it's hard to say if they are or not, but we have a free mini course, also have a couple free downloads you guys should check out. Diagnosed with PCOS, I researched seed cycling and supplements. My doctor dismissed them, thought they're popular in India. Okay. So there's a couple companies that I actually love for seed cycling. One of them is Funkit Wellness. I think I might have a discount code in my bio. I'm not sure. The other one is Bia. I've had young patients really, really think that it's great. Tabitha, good to see you on here. Hope you guys are doing well, and I hope your daughter's doing well. So I'm glad that you are doing better. Sammy, I thought I was in menopause, but I think I may have been going through amenorrhea. Yeah, sometimes it can be difficult to tell. A little bit depends on your age. So a lot of times by history, we can diagnose whether you truly are in menopause, but you're right. Amenorrhea, no period for 12 months is another reason to not have periods. We see that a lot in young girls. That's called the female athlete triad. Again, I had a patient I was talking to today. She's not exercising as much as she was in high school, but she's still not having periods. She's got an underactive thyroid. She's got Hashimoto's, and she's really, really stressed because she's a medical student. So that could be enough to suppress your brain. It's at the level of the hypothalamus. So that could be the problem. Oh, Sammy, you're 45. Okay. Yeah, getting hormones checked could be really helpful. It's a blood test. Okay, yes, Tabitha. I think that cycle map is a great test for young people that it's a cumbersome test, checking your labs 11 times throughout the cycle. But I have gotten some really great information lately from some of my patients. So it's great. Sammy, 2 years no period and just started high stress levels. So yes, it could be what I call hypothalamic. It just would matter what your blood test shows. So if you had a high FSH, that would support that you were menopausal. If you had a low FSH, that would support stress. So if it was really low, like less than 1, that would be hypothalamic stress. So I don't know if they check that.
Wendy wants to know what is slow release progesterone.
What is slow release progesterone? So a lot of people can't tolerate the commercially available progesterone that you get at Walgreens, micronized progesterone. So because what they do is they put it in oil, so you take it and all of the progesterone is dumped into your stomach. That'd be like if I watered my plants once a week. It can only absorb so much, right? And the rest just is wasted, not wasted, but it's like overflow. So pharmacists can slow the release down. It's not technically a slow release. It's not a sustained release, but a lot of drugs, you can get sustained release or extended release. So the pharmacist can do that. And it's so much better tolerated. However, it's a compounded prescription, may not be covered by your insurance. Most compounded prescriptions, if your doctor is working with a compounded pharmacy, is only about $40 to $50 per prescription per month. That's what it is in my area. So it's not terrible, but it's a cost, an added cost. Vet girl, what are the symptoms of estrogen dominance and how do I fix it? I'm also insulin resistance. Well, actually, insulin resistance worsens estrogen dominance. So we'll keep working on your insulin. Intermittent fasting is one of the fastest ways to drop your morning insulin. I just reviewed a study. I made a couple of videos today that time restricted feeding, which is intermittent fasting versus a 1-day water fast. The 1-day water fast was a little bit better for weight loss. Symptoms of estrogen dominance can be heavy periods, heavy bleeding, breast tenderness, weight gain at the hips, back of the arms, and the chest, migraines, anxiety, that kind of thing. Okay, thank you for the gifts. I'm still not sure what the gifts mean, but thank you. So this period I had on HRT after a year in menopause, do you think I actually ovulated? Not statistically, no. Statistically, you maybe had a hormone shift. And, but I mean, I guess you could, but it's rare. I have seen it happen. But that's why we usually check out any postmenopausal bleeding. But great question. So it's not uncommon. Gem 96, I've never been on hormones and had a ruptured brain aneurysm at 28. I'm now 44. I have at least 2 or 3 patients right now that I can think of that had ruptured aneurysms. One of them had an AV malformation. One of them had, I think, an aneurysm, cerebral, and they're safely taking hormones. So it really just depends on your situation. I'm not saying you can or can't. I'm just saying that I have met with these patients, reviewed their literature, and also with the blessing of their hematologist or their neurologist, they are able to take transdermal estrogen. So, okay, so it looks like my battery is running dead. So for those of you just joining, want to make sure you check out my free mini course. The link is in my bio, and we have 2 free downloads now. One is about the testing, hormone testing. There's a lot of confusion about that. There's also one about natural therapies for mood disorders. We also have a free weekly newsletter comes out on Tuesdays. Is that on the website?
They go to the website. Dr. Tara Scott.
If you go to Dr. Tara Scott's, my website, you can sign up there. I would love it if you would subscribe to my YouTube channel. If you're not following me here, also follow me on Instagram. And let me see, I could probably do a couple more questions. Mrs. Parker for real, why do doctors suggest SSRIs when dealing with hormone imbalance? So here's the thing with traditionally trained doctors. I am a traditionally trained doctor, so I can tell you this is what happens. We are taught to make sure you don't have cancer and rule out pathology. When that happens, we have what's called algorithms, okay? Treatment protocols. So it means if you have this, there's no this or this, give this. It's not like thinking like, okay, what is really going on with the patient? What's the root cause? What are the hormones? That kind of thing. It's just like, you have depression, take this. If you have depression in your 40s, it could be low progesterone. It could be low estrogen. It could be high estrogen. It could be low testosterone. Those are all things that we look at as hormone providers. But I didn't know that because I wasn't taught that as a traditionally trained OB-GYN. So that's why, Ms. Parker, is because that's how we're taught to give them. Jazzy Michelle, great to see you on here as well. Thanks. I know I've taken a little bit. I'm trying to still do the lives as long as I'm not traveling, but I really haven't been posting much because, like I said, it's time consuming, and haven't had much time to make any videos. I've been busy with my patients during the week, and on the weekend I have been teaching various doctors around different conferences. But it's so great to spend time with you guys today. I catch me live, tune in Tuesdays, 7 p.m. Eastern is when you can catch me. Oh, Jaleel. Oh my God, Jazzy Michelle. Tell Jaleel I said hi. I hope he's doing well. Yeah. Do you mind dropping the website where I can find doctors? Okay, it's the letter A, the number 4, the letter M.org, I think. So hopefully you guys can look in the right-hand corner up there. It says provider directory. All right, guys, hopefully you are staying cool. I know where I am, it's been in the 90s. It's so hot. We had such a cold winter, and it's no in between. So hope you guys are doing well, and I'll see you next week. Bye. Sorry, that was not me farting.